The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone, and welcome to another episode of the Dental Brief. So glad to have our podcast guest on today. I believe this is his third time on the program. Russ Ledbetter, say hello to everyone.
Hello, everyone.
Hey, it's so good to have you here. Again, grateful for your time. Thank you for sharing. Russ, you've been consulting for, I know quite a bit of time. Your family has been in the dental industry for a long time, but why don't you just go ahead and give us a little background? Tell us about yourself and how you got involved in dentistry.
Well, I myself have been consulting dentists for 35 years. It was a family business, started 37 years ago. So I came along out of college and saw what they were doing, got interested, and next thing I knew, I was doing it. So believe it or not, it's the only job I've ever had. Never had another job since college. This is it. I just tripped into it, so to speak. But I love it. I like helping dentists. They're the highest stress profession in the country. And with all the DSOs and private equity and corporates coming in, it's hard to compete. Inflation is killing them. And,
Sure.
I get a lot of pleasure out of not only increasing their production, but reducing their stress level at the same time. So Make more money and have more fun and work fewer hours. That's what I'm up to help the dental community.
Yep, makes sense. Let me just give the website real quickly. We'll go over it again, but it's dentalconsultingexperts.com. Pretty easy to remember, dentalconsultingexperts.com. Russ, tell me, what are some things that you see going on in the dental industry right now? What are some trends? What's happening? What's the word on the street?
Well, if I might, I've been thinking about this a while, and what I want to talk about, I kind of have a case study, if that's okay. I think real life examples really sort of hit home better than theory. You know what I'm saying?
Sure.
So one thing I think that holds back the average dental practice, an established practice, is the fact that doctors tend to wait around for hygiene to be busting at the seams to expand it. And hygiene is the profit center of a dental practice. I mean, you pay your hygienist, and then that's about it. The amount, there's no lab bill, the supplies used are not very big. So, and you diagnose dentistry out of hygiene. So, when you expand hygiene, because hygiene is about a third to 35% of the practice's direct production. And then about another third or more comes from diagnosing out of hygiene recall patients. So you can say that 70% of the practice comes out of hygiene. Now, what I've noticed with my clients, and I'd like to use a case study just to illustrate, this is an actual real life example that happened with me. But the point is that staff members don't stress out about filling hygiene appointments 2 and 3, 4, 5, 6 weeks from now, right? They are worried about filling openings in the week. So no one is ever actually trying to build hygiene for the long term. So what happens is you get new patients in, and then some of your patients fall through the cracks. They don't reschedule, they cancel, they no-show, they whatnot.
Sure.
And they're just sort of out there. They're not going anywhere else, but they're not going to you either. They're just not thinking about the dentist. So you got all these new patients coming in, and they're filling the holes, and hygiene looks really good. But here's the problem with that. So the example I'm going to give, I won't use names, but it was a father-son dental office that hired me. The son actually hired me. And I came in, and they were doing fantastic. They were getting 60 to 70 new patients a month.
Wow.
Now, remember one summer, I came into the office and I was looking at their numbers, and I was like, wow, 60 to 70 new patients a month is phenomenal. You don't really see that a whole lot.
Sure.
But what I did is I looked back a year ago, and I looked at their hygiene numbers. They had the same number of hygienists. They were doing the same number of hygiene patients per day. and they had the same production. So what does that mean? Well, a year has passed and you're adding 60 to 70 new patients a month, then you must be losing 60 to 70 a month to be staying status quo.
Right. Yep.
So I pointed this out to the doctor and his office manager, and to the office manager's credit, she saw it clearly. And she said, oh, and she plugged those gaps. She absolutely let no one fall through the cracks. So I finished up the year. By the end of the year, they had added another hygienist. And about 2 to 3 years after we finished with this client, the son called me up and said, Russ, we have now 6 hygienists instead of 3, and we have 2 new associate dentists, and we're still busting at the seams. And they built this brand new big, like Taj Mahal dental office down in Columbus. So, they were getting the same number of new patients, but they weren't managing it, and hygiene was just staying static because people were only filling the immediate urgent needs. So the point is if hygiene is telling you it needs growth, you could have grown long, long time ago.
Yep.
So if it's busting at the seams, you have given up maybe months, years, or whatnot of growth if you had managed that. So you want to take a look at your new patients, and if your new patients are strong and your hygiene is sort of static, then you want to push it.
Sure.
So I used to give an example. You may be old enough to remember. Do you remember the old movie Kevin Costner, Field of Dreams?
Yeah, of course. Yep. Build it and they will come.
Yeah, build it and they will come. That's
Yep.
how it works with hygiene. You add hygiene, and then guess what? Your staff has to fill it, and they will. Now, if you have 5 new patients a month and you have holes in your hygiene schedule, I am not talking about that. You don't go out and hire a new hygienist.
Sure.
But there are tons and tons of practices that if they just added up, and you can do it 1 or 2 days a week, you could add, who knows if you have enough to add a full-time hygienist. But people also are afraid, and they got to keep in mind, if you add a hygienist, all you need to do is put 2 patients on their books, and they'll break even on their salary.
Right. Yep.
So you're not losing anything by adding a hygienist. If you can just keep 1, 2, 3 patients a day, and then, if you have an outgoing hygienist, she can work on her books the rest of the afternoon or whatnot. In the typical dental practice, the patients are there. It's like the same thing that happened to me. I fell through the cracks of my dental office. So I went every 6 months and got my teeth cleaned. And then one time, this is an old story, but a long time ago when the Palm Pilots came out that preceded the iPhone and the smartphone, I had left mine at work and I didn't reschedule my hygiene appointment, and they never followed up with me.
Right.
So I was driving my daughter to school, and the school's a mile down the road, and the said grand opening of this new dentist. And I said, how convenient is that? And
Right.
instead of driving 8 miles, which in Atlanta, Georgia, 8 miles can take you 20, 25, 30 minutes to get.
Sure.
This is less than a mile from my house. So I called them up and scheduled an appointment. Now, if they had called me the next day and say, hey, Mr. Ledbetter, you forgot to set up your appointment. We need to get you on the books. I would have scheduled a hygiene appointment, and I would have kept that appointment because I wasn't unhappy with them. I would have still been a patient of this other practice. I would have just driven down the road and said, oh, another dentist is open.
Sure.
Since I wasn't on their books, I took that advantage and I changed dentists. So, they lost a patient because of that, but you're not necessarily losing patients. They're just out there. They're not on your hygiene books. They're still your patient, but they're not thinking about dentistry. They're
Right.
caught up in their busy lives. So
makes sense.
there's a ton of lost opportunity of actually working on hygiene. And every now and then, I'll be honest, I come across, and a lot of times they're old school practices with an older front desk, that when I come in, they work hygiene regularly, and they're booked up 5, 6, 7 months sometimes.
Sure.
In advance. And they're doing it right. They're keeping their hygiene full. No one falls through the cracks. But in a typical busy dental front office, the only thing that gets attention is schedule openings maybe later this week or early next week. No one is considering anything beyond that. So if you're getting in a lot of influx of new patients and your hygiene is not growing, it's just because you're pretty much letting the same or almost as many new patients or not existing patients fall through the cracks, and get off of your hygiene books to make room for the new patients. So new patients are extremely important to a practice. The typical new patient needs more work than the recall patient, but you want to make sure that you keep everyone. If anyone cancels an appointment or no shows or any way, shape, or form comes off the schedule, you've got to get them back on.
Right.
Now, you can come to a point, like most single doctor practices, he or she would like to check maybe two hygienists. I have some that will check two days a week and three 2 days a week. I have rare ones that want to check three hygienists, but those are fewer and far between. So if you're getting a lot of new patients and you have three hygienists and you can't check four or don't want to check four, then you don't have this problem. But I would say you want to grow hygiene. So then if you have a goal of bringing in an associate, you can start doing things of that nature, because you're losing out by letting people fall through the cracks. Lot of lost revenue. I mean, big money. And by plugging those gaps, you can see what happened with the father-son in Columbus. 2 new dentists, 3 new hygienists, doubled their hygiene department from 3 to 6, doubled their doctors from 2 to 4. And, I've seen their office. It is absolutely gorgeous. So they are busting at the seams. They're killing it. But they were treading water up to that point. That's why they hired me, obviously. And I have to give them all the credit. They plugged the gaps, didn't let hardly anyone, 2 to 3 patients a month might move out of town, pass away, or leave your practice. But if you're getting 30, 40, 50, 60 new ones a month, and you're only losing 3 a month, you're growing, and you will have to add hygiene. If you're getting all those new patients and you're not growing, it's just you're leaking as fast as you're putting in new patients. That's why I mentioned the movie Build It and They Will Come. It's like if you add hygiene, your staff will fill it up to a point, obviously.
Yeah.
You can't go from 3 to 6 hygienists in one. That's not feasible. I'm not talking about that. But if you have 3 hygienists and you're getting 30 new patients a month, you're going to eventually very soon need a 4th hygienist.
So if what do you say, and I know we're kind of getting towards the end of the program here. What do you say to those that are saying, "Hey, it's so hard to get a hygienist. There's, they want too much money, or there's not enough of them, or there's a shortage, or what have you." What do you say to them when they're already full, but they're just like they don't want to go through that. They don't want to deal with the challenge, and don't think it's worth it.
That is an excellent question. I heard one of my clients is the past president of the Georgia Dental Association, and he was telling me that COVID wiped out about 40% of the hygienists. They either retired early or they found a different profession, and they're just not training enough new ones to keep up. So shortage of hygiene is a serious, serious problem. You might not want to hear this, but if you're trying to find a hygienist, you're almost certainly going to have to attract her away from another dental office.
Right.
Or him.
Sure.
You have to write an ad. You have to have the benefits. You have to have the pay that is going to draw them from another practice to you. And I get the whole cost thing, but if you're paying a hygienist, I'm seeing here in Georgia hygiene salaries at $55 an hour, which I've never seen.
Sure.
And sometimes even higher. But just before COVID, I think $35, $38 an hour was the norm. Now it's $55 an hour.
Mm-hmm.
But think about it. It depends on your practice. If you're heavily insurance based, that's going to be very expensive because of the write-off. But if you're fee for service and you're doing $250 a patient and you're paying a hygienist $55 an hour, you're getting $200 per patient. So not an issue. You've got to pay what the market demands. Otherwise, the only other thing to do is if you have the chairs, to hire a cheap assistant at maybe $16, $18, $20 an hour. Probably even less than that if they're, a hygiene assistant doesn't really require that much training and they don't have to have job experience. You can get them right out of high school. So you might even get them for $15 an hour. You put them with a hygienist and you go accelerated hygiene or speed hygiene or assisted hygiene, whatever terminology you want to use. But that doesn't equal another hygienist. You can't have two patients at 8 a.m. You can't have two patients at the end of the day, and you can't have two patients before lunch and after lunch. So really you're adding about 70% of hygiene, but you're saving big money on the salary of the hygienist as well. So the hygienist does all the cleaning, everything. The assistant does everything else, the x-ray, the scheduling the appointment, the turning over the room, the whatnot. So the hygienist scales and polishes, does her co-diagnosis or pointing out areas of concern. So when the doctor comes in, the patient's set up for that, takes intraoral camera pictures, whatnot. And then the assistant does everything else. Yep. Some people are not a fan of that, and some hygienists actually won't do it. There are some prima donnas out there that are like, nah, not doing it. And some love it. So it really depends on your situation.
Sure. Awesome. Mr. Ledbetter, Russ Ledbetter, thank you for coming on the program. One more time, the website is dentalconsultingexperts.com. If you guys are looking to grow your hygiene departments, looking to grow your practice, reach out to him. And any of the consultants that you've heard on the program that you like, I'm going to encourage you to call them too. Russ, thank you for being here.
Patrick, thank you for having me. I appreciate you doing what you do. Thanks. Have a great day.